Today I want to talk a little bit about my patient, Heather. Heather came to me like a lot of my patients. She was scared. She had had a lot of bad prior dental experiences as a kid, and then what she noticed over time is that her teeth were starting to loosen. She had teeth that were moving. She had pain on chewing at times. And she also was noticing she had some bad taste in her mouth. People were complaining about bad breath, stuff like that. So she finally got the courage to come in. She had seen some of our advertisements explaining what we do, who we are. And it is important for my patients to know that when you come to my office, Dr. Lampee, Teeth in 24, you're gonna be welcomed with open arms, with empathy. When Heather came in, like a lot of my patients, we realized that she had severe gum disease. Now, she came in at just the right time that we were actually able to save her teeth. When I met her, I knew she was scared. I knew that she also ran a dog rescue, and I know that she has a big heart. And these are my favorite patients to work with, people doing amazing things in the world, people who want to shine their light on the world. And so when Heather came in, we realized that our Periolase Lanap laser could help arrest her gum disease, stop her gum disease, and even regrow some bone and kill this bacteria that's getting into her bloodstream, affecting all of these health issues. For a lot of my patients, I know they're terrified. I know they're scared to know what's really going on in their mouth. They're scared from bad prior experiences. Sometimes they're scared of a cost, and they wait a long time to come in. Now, if Heather had waited too long to come in, let's say she waited another 3 years because she was super scared. So if she waited 3 more years, what we would have found when she came in is that her teeth were unsalvageable. They would have been hopeless. The gum disease would have been way too far gone. The pus pockets would have been too bad. There would have been too many infections draining into her sinuses, into her jawbones, and then into her bloodstream. And so at that point, when the teeth are that far gone, when they're very, very wiggly, when they have almost no bone and gum tissue holding them in, we have to say goodbye, adios. And when we do that, we have to do our Teeth in 24 implants, where in 1 day with sedation, we remove the teeth. And once the teeth are out, I spend a good deal of time removing infection. I flush these areas with different antibacterials. I actually will scoop out infection, and it's only then, when the gums and bone are clean right then and there, that I put those implants in that very same day. You get your brand new smile. No more bacteria leaking into your bloodstream. It reduces your risk of heart attack and stroke then. We know how to do our laser work. We know how to do our full mouth crowns and veneers for our patients who want to save their teeth. For those patients that are done with their teeth and or we cannot save them, we do our full mouth Teeth in 24 implants. And seriously, you give me a day, me and my team are going to change your life, your health, your outlook.